even though the healthcare industry may feel like it's been isolated from a lot of the massive disruption that has been occurring in a lot of other industries, it's pretty clear to me that most of you in your personal lives probably have felt the incredible power of digital disruption. Think back to the middle to late 90s when our good friends from Netscape launched the Mosaic browser, and think about what's changed in your lives since then. Think about how you read the news. Think about how you listen to music. I bet most of us stream music on Spotify or Apple Music or any one of a number of other services. Think about how we watch movies. Most of you probably order groceries from Instacart or from Amazon Prime Now. Think about how you do banking. What a joy not to have to wait in line for a teller on a Friday afternoon, right? So personally, we have felt the incredible power of disruption over the last 20 years. And so there's been a massive amount of turbulence going on, and you can only imagine the consequences of this turbulence for a lot of companies that were, in fact, on the wrong side of the disruption curve, okay? In my hometown, they now sell dog food out of the Blockbuster. I guarantee you that the shareholders and the leadership team of Blockbuster didn't intend that to happen. And it's an insane thing to me when an executive team can be so complacent that they own 10,000 brick and mortar stores, they have 95% market share, they have contracts with every major Hollywood studio, and they completely ignored the threat of this tiny little company named Netflix that was born out of frustration because Reed Hastings rented the movie Apollo 13 and he forgot to bring it back for a week. Wow, that was an expensive mistake. That cost twice as much as the shirts as these teams made for themselves, okay? And Reed Hastings may have an English surname, but he was very Sicilian. He didn't get mad, he got even. Very even. And that's what happens when you have complacency and when your executive team has status quo bias. As I mentioned very briefly a couple of days ago during the kickoff, although this young 19-year-old man at the time, Sean Fanning, a sophomore at Northeastern University just down the road, he doesn't look like an anarchist. He's clean-shaven, he's got on a beloved baseball cap from the Red Sox. But make no mistake, this young man unleashed a level of anarchy in the music industry that they are still dealing with today. And the thing that's amazing about Napster, it only lived for 2 years before it was sued out of existence by the music industry. But in those 2 years, they unleashed something that took away 50% of the total annual revenue of the industry. A $30 billion industry became a $15 billion industry. Imagine running a company in that environment. Or that wonderful phrase today, we were Amazoned. Whether it be Sears, Roebuck and Company, or so many retail stores that we've all shopped at growing up that are no longer around, right? So now, what's amazing to me, right? I've lived a good part of my life in Silicon Valley. I travel a couple hundred days a year, so I see a lot of stuff. And what I have seen is the pace of change is accelerating and accelerating again. And now, the healthcare industry's time has really come, okay? And what I would say is, heavily regulated industries, whether they be financial services or insurance or healthcare, have had a bit of a moat around them. And so they've been able to avoid, up until now, a lot of these massive forces that are taking shape. But those days are over. And so I'm going to now act as a messenger from the future. And I'm going to share with you some of the things that I've seen, some of the things I've read about, that will hopefully give you some context into what is happening outside the four walls of naviHealth, okay? So like any organization, just like Wayne Huizenga had that opportunity at Blockbuster and did the old thing, which was, we're going to just keep doing what we're doing. It's worked well for us so far. We've got 95% market share. Ignore the man behind the curtain. Reed Hastings, he's got no game. We're good, okay? But what I would say is, a very ancient Chinese proverb, when the winds of change blow, there are those people, like Blockbuster, like Sears and Roebuck, Eddie Lampert, who drove that company into the ground, that hunker down. They go into the storm cellar, they pull the door shut over them, and they hope that the storm passes over, but it never does. And then there are those organizations that take the opposite approach. They build windmills. So let's look at some organizations that are building windmills as digital health begins to permeate the healthcare industry, okay? Anybody ever use ZocDoc? Okay, a few of you have used ZocDoc. Cool, just a few. So I live close by. I'm never here, but I live close by. And I go get a lot of my work done at Newton Wellesley Hospital, which is probably half a mile from the naviHealth offices. And when I go to schedule an appointment with my primary care doc, the message is, well, that's going to be at least 3 months. Now, when you travel 200 days a year, I have no idea where I'm going to be in 3 months. So I never get to keep those appointments. So the appointments I always have is with my physician's assistant, and I haven't seen a real primary care doc in years, right? Well, that's the issue that ZocDoc is addressing. ZocDoc is basically a matching, it's Tinder to match patients and doctors, if we can be so direct, okay? And there are people in this room that get that because they're on it all the time, okay? But what they've done is they've collapsed the time to find a doctor from the average, from what I've been reading, and you, by the way, I'm not a healthcare expert, so do not in any way let me pretend that I am, okay? But I do know a little bit about innovation, and that's kind of why I'm here today, right? 2 days, you can find a medical doctor on the system that is in your network and that has been highly rated, and you can determine the radius through which you want to find that doctor, and within 2 days you got yourself an appointment. That's a little different than my experience, okay? Oscar, the millennial-focused health insurance company. Anybody know Oscar? Anybody in the room, some of the younger folks using it? Yeah? You like it? Okay, what is it that you like about it? So it's got a wizard that helps you through, right? So the millennials have done us a great service, right? They've forced industry to make things a lot easier to use. And so Oscar has raised $1.5 billion in venture capital, and it's got an enterprise value of about $5 billion, and I love it. We didn't start this company because we liked health insurance, in fact, just the opposite, okay? We give up to 3 free visits a year, so hypochondriacs can rejoice, okay, which I just love. I know a few people, and I love this. We're a handcrafted artisanal health insurance company made specifically for Brooklyn, okay? But this is what I'm seeing in financial services, right? There's a completely different mindset and ethos in the way that these apps are being designed. And then collective medical, right? And when I mentioned this team, or this company, to a couple of teams in the room, and said, check them out, one of the teams said, it sounds exactly like what we're doing. And so collective medical's reason for being is to get the right data to the right healthcare professional at the right time, wherever they may be in the network, okay? Simple value prop, incredibly difficult to execute, I understand, given the interoperability issues, okay? So let's look at how some of the big Silicon Valley giants who own all of our data are thinking about this, right? Let's look at Tim Cook, right? Tim Cook makes a powerful statement. If you project yourself into the future and then look back and think about what do we want Apple to be known for? He's not saying it's the MacBook. He's not even saying it's the iPhone. We want to be known for helping people improve their health, okay? We're democratizing healthcare. We're taking what has been with the institution and we're empowering the individual to manage their health. Now, think about where Apple started. They were a PC company. And then, with iTunes and the iPod, they became the largest retailer of recorded music on the planet. So they know how to shapeshift. And then in 2007, they launched this little product called the iPhone. And for guys like me who keep score, the iPhone is without peer the single most successful product on the planet. They have sold 1.6 billion of them in about 13 years. You know what the second most successful product in history is? It's the Barbie doll. And I'm not making it up, it's true. It took Mattel 80 years to sell 800,000 Barbie dolls. So just look at the velocity. So they shape-shifted a second time. A company that was all about laptops became the world's greatest music company, world's largest phone company. And oh, by the way, the Apple retail stores are the most profitable retail stores on the planet. More profitable than Louis Vuitton or Gucci or Prada. So when these folks decide to do something, their track record of execution is pretty good, okay? And who owns other than our friend who just won one, congratulations by the way, does anybody wear an Apple Watch? Does anybody wear an Apple 5 series watch? Okay, nobody yet, so no real device geeks in the room, okay? I will admit, I'm a Silicon Valley guy, but I'm not a device geek, but when I've been reading a lot about the Apple Watch recently, and the Apple Watch Series 5, right, and just like Steve Jobs was uniquely capable of going out to the music industry and convincing all of these record company executives that they should take their album and they should unbundle their album and they should break the album into songs that were all sold at 99 cents because the relative equation was, do you want to sell 0 or do you want to get at least 99 cents once or twice? So it was a pretty obvious decision. But only a company like Apple can now go out to the community and say, we want you to be able to share patient records with us. And so now we're starting to see the iPhone 5 being able to actually manage your own healthcare records. Okay, it's pretty remarkable. And the other thing I'll say about this is that I've been reading a lot lately, and I know some others have mentioned that they've heard this as well, that the Apple 5 watch has saved people's lives already because it's able to detect irregularities in heartbeat. And even though the owner of the watch didn't even go out and deliberately set up the alerts, the system was smart enough to tell them you need to go get medical attention. There have been a number of well-documented stories of people that have had their lives saved. So I'm now at the point where I'm ready to go buy one. And I think it's really an amazing thing. Now, patience as innovators has been around a long time, but it's becoming very powerful. But there's one in particular that I want to highlight. Anybody know the website known as Patients Like Me? Okay, just a few of you. So Patients Like Me was it's a Boston-based company. It was, not surprisingly, like many cool things that happen around here, there's a tie to MIT. And it turns out a young man, he was in his mid-20s, he had contracted ALS. And his brother, who was technical, decided he would do something to help him because the level of knowledge around that disease at the time was really limited. So they created a website which would allow for peer-to-peer patient support around ALS. Today, Patients Like Me has about 600,000 members in the community. Okay, it's very effective. And patients upload, this woman happens to have epilepsy, but they upload their profiles. And then you go through the process. You share your health profile, you look for support from others like you, and you compare your experiences. You learn from aggregated community treatment and symptom reports. There's about 1,000 peer-reviewed reports in here. Okay. You bring the profile to your medical professionals and you have an improved treatment conversation. And you then become become a self-advocate. Okay? And what's happened recently is that a lot of pharmaceutical companies are now looking at this data and it's helping them to make more informed decisions about drug targets. Now, I'm going to spend some time toward the end of my presentation talking about how 23andMe, the personal home DNA kit, is using what is now the world's largest consent-based DNA database. And they're working with GSK, GlaxoSmithKline, to look at this DNA data and come up with a bunch of potential targets as well. So there's a lot of contributions now from patients to these drug discovery targets.